Hi everyone, I'm Melissa Surgey and I'm a PhD fellow in the ARC. And today I'm going to give an overview of my PhD project, which is exploring the role of commissioners in place-based health and social care. So my project topic is a response to the current health and social care policy trends, most notably the integration of health and social care. And a commitment to joined up health and social care has been apparent in several publications setting out the strategic direction of the NHS over the last decade, including the 5-year forward view and the NHS long-term plan. And there has been increased focus on integration of services around geographical areas. So joining up services to serve a particular community closer to home, as well as multiple health and care commissioners and providers working together on bigger footprints to provide more specialist services more sustainably at a regional or sub-regional level. The most recent policy initiative is the development of integrated care systems, or ICSs. These will bring together all health and care partners in regions serving upwards of 1 million people, for example, Greater Manchester. And these ICSs are made up of a number of places, generally, but not always, aligning with local authority boroughs, for example, Bolton or Stockport. And finally, places are subdivided further into neighbourhoods serving communities of 30 to 50,000 people, supported by GP practices working together. The evolution of integrated health and social care policy over the last 10 years is set out in the timeline on the left of the poster. And all these policy initiatives assume a common understanding of what place is, or that place is obvious. And legislation and policy has remained quite ambiguous about defining clearly what systems, places, and neighbourhoods are and what they will do. And that leads me to my own PhD research. So I'm seeking to identify and address the gaps in current policy and legislation, and I've chosen to focus on the commissioning part of the health and care system. This is because commissioning, which is generally the process through which health and care services are planned and purchased, is largely misunderstood both by policymakers and those working in health and social care in terms of a broader role in providing strategic direction, support and mediation, and accountability. This is reflected in the absence of any meaningful blueprint for what commissioning will look like in the new health and social care landscape. So I formed my research questions around the what, where, and how of commissioning. So firstly, I will be looking at what functions are being delegated in the system, place, neighbourhood spatial model, what functions are being delegated to where, and how they are defined and constituted. And finally, how do all these different spatial levels interact with one another, and what accountability mechanisms are there to underpin this? So to address these questions, I'm going to use a qualitative approach in my research, and that combines 6 key study components shown in the top middle diagram here. And that combines primary and secondary data. Components 5 and 6, which are the literature review and the policy review, have been my main focus this year, but they're ongoing because that reflects the rapidly changing nature of the policy and literature. The majority of my primary research will use a case study approach, and I'll be focusing on 2 ICSs. Within each ICS, I will choose a single place as a subsite, and over a period of at least 6 months, I will be observing meetings and committees at both sites, undertaking one-to-one interviews with senior health and care leaders, and reviewing key documents to help me build a picture of how policy is being transacted in reality. I will be collecting data at all 3 spatial levels in each ICS to gain an understanding of how the relationships between these work and what authority is devolved where. Whilst the number of my case study sites are limited by my capacity as a lone researcher, I will be carrying out triangulation interviews from other places within my chosen ICSs to validate or dispute any trends I'm observing. A schematic of where I intend to collect data from is shown in the bottom middle diagram on the poster. And finally, I'm going to be carrying out interviews with national policymakers and decision makers, for example, from NHS England, central government and national representative bodies. And this will enable a comparison between national and local perceptions of policy and its implementation. So I now want to present some key areas of debate that emerged from my literature review, and this particular regards place. And I've been looking at three key lines of inquiry: whether place is fixed or relational, whether it is political or neutral, and whether it is obvious or ambiguous. So with regards to fixed or relational, the current policy presents the three spatial levels as fixed geographical footprints. They're almost reduced to lines on a map, but this misrepresents places as being coherent. The very concept of a coherent geography is challenged throughout the literature, and it's often expressed that policymakers have historically overestimated how coherent place is. Put simply, the very nature of how communities and the individuals within them go about their everyday lives, they do not recognise nor respect arbitrary boundaries. Moving on to whether place is political or neutral, and NHS planning is very much presented as a technical exercise, but the very nature of what we're currently asking health and social care providers to deliver in terms of increasing resource constraints and efficiencies is inherently political. And this shift in solution finding from a national level to a local level is problematic because often local issues are a result of political factors that are beyond the control of local leaders and actually require national solutions. And finally, the vagueness of place presents a lot of practical challenges for health and care partners, including all of those partners in a single place, understanding who they should work with, and do they even all agree on the same definition of place. It's very problematic in the commissioning space, with this proposed new commissioning infrastructure will potentially remove commissioners from place level, with more work being undertaken at ICS level. So with regards to the consequences of these findings, I've been conceptualizing my research on a scale of ambiguous to defined, which you can see in the diagram on the right-hand side here. We've got much of the relational literature around place on the far left-hand side, and then we've got the more defined end, which in theory is supposed to be the policy, it's supposed to be transactional. However, as I presented, this is not always the case. We then end up with a paradox where we need to acknowledge that place is fluid, relational, and diverse, so ambiguous by nature, but also the practicality of needing to draw boundaries to implement the infrastructure to oversee and support the delivery of healthcare services. This is the gap that my research is seeking to fill. I've outlined my next stages of research below, with my primary focus on revisions to my ethics application and preparation for my fieldwork. And I've also included in the bottom left-hand corner a summary of my training and development over the last year and where I think those gaps are. But thank you very much, and I'm happy to take any questions on the day.